Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadijah, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Hello and welcome back to Balanced Beauty Talks. Today we're just going to be a little bit lighthearted and fun, and we're going to talk a little bit about behind the scenes at Natology, all the magic, the chaos, the prep, and the little things that clients never see.
Yeah, so I think a lot of people don't know what goes into each appointment, whether it's a consultation or a facial or microneedling. There is a lot of prep before, and there's a lot that happens afterwards. We kind of wanted to take you behind the scenes so you can get an idea of what goes into any appointment, really, at Natology.
Yeah, it goes, everything from room preparation to file review, charting afterwards, and just making sure everything is just right for you because we are so nervous system focused here. We want to make sure the environment is just perfect when you walk in too. So before you start your day at Natology, you come in. We all come in a little earlier to make sure we got our feet under us before you show up at the front door. What's the first thing that you do?
Well, we go through the schedule. So usually I have an idea of what the schedule is going to look like already, but there's always like changes that can be happening if people are added into the schedule. So just having an understanding of what the flow is like for the day and what prep needs to be done. So if it's really busy and it's back to back, we need to make sure that if we're going from two different rooms back and forth, that both rooms are set up or that there's like an easy flow between appointments. And whatever is required, I guess, for that appointment. So facials, we'll fill up our hot towel warmer. And then if we're going to be doing a laser treatment, then just making sure that room is set up. All the supplies that you need are in the room, that the ambiance is set up in the room, the lighting, the bed warmer. If you need any restocks of things for specific treatments, just making sure everything is ready so that the day flows as best as possible. Yeah, I don't know. Is your flow kind of similar?
Yeah, it's the same, except for the first thing that I do when I walk through these doors is I walk straight to my treatment room and I turn on the hot water because it takes
a
long.
while. Yeah, it does take a while. You have to run it for a while before you get hot water.
Yeah, so on comes the hot water, and then I go take off my jacket, and then we start the room
I should do that
preparation.
because I'm just standing there sometimes for a while waiting for the hot water.
Yeah, building problems. So.
Yeah. And then if it gets too hot and then you're trying to get the towels in and you're burning your hands and it's just good to have it.
Totally. And then, I would say like for me, I go straight into what's my first appointment charting look like and making sure that they are suitable for the treatment or what I did on them the last time to make sure I'm going in with some knowledge and exactly kind of, how to plan out for today. So,
Yeah, and for new people, we have consent forms and intake forms. So going through those is really important just to make sure that we're covering all our bases. We know what questions to ask. On the naturopathic side, for me, there's a lot more prep that goes in just because our intake forms for that are very comprehensive. And so I will usually go through that whole thing and pull out the things that I need to and put it into a separate chart so that there's flow there when I'm asking questions or if I know I'm going to need more information or will want to ask certain questions, I put them in the chart right away. So there is a bit more prep, but I feel like even with skin consultations, sometimes if we see something on a form that we need to inquire more about, there's a bit of prep that goes into that.
Especially if somebody is coming in for acne, you do naturally want to be digging a little bit more and get a bit of a history on when it started, what could be causing it, and have our questions lined up and ready to go for you. So and then there's the time that we spend post treatment. So sometimes that happens late at night after we get home. But we go back and we chart everything that we did on you that day, your main concerns, your main goals, any any important things that we feel we need to have recollection of in
Mm-hmm.
the next appointment.
Mm-hmm. Same. That's like
Yeah.
exactly what I do. Sometimes I will add in, depending on the client, like a future plan if I feel like I need to make sure I know where I was going with certain things, because sometimes it's a bit more complicated to recall things. Even if you just have like what you did in an appointment, it's nice to have a plan that you've already set out for people. So I feel like that takes a bit of time to do. Yeah. And then I guess what other things would you say you do post treatment, like in the room or the flow that happens between clients outside of charting?
Yeah, after that, we want to make sure we're doing a follow-up of some
Yeah.
sort, especially for those more invasive type of treatments.
Mhm.
And so that can be anywhere from just
Yeah.
24 hours to 1 week out,
Yeah.
just to make sure that everything is responding just as it should, that that you're feeling, cared for and looked after. And sometimes there's a lot of collaboration between us too. We can't do that while we're in the treatment room with our
Yeah.
clients or patients, but sometimes we'll have some powwows, we
Yeah.
call them, and discuss like, what would you do in this scenario? Would you
Mhm.
do anything different? This is the lineup of products that I was thinking. What would you recommend? And
Yeah.
kind of go back and forth on ideas, and especially with the internal aspect, because the
Yeah.
cause of any condition can be just about anything.
Yeah.
So it's really nice to have some internal knowledge
Mhm.
and bounce that off of you.
Yeah.
Yeah.
Yeah, and the way the skin responds is so different depending on the internal environment for people.
Hmm.
So, yeah, I mean, it's nice to have a very diverse team with different experience levels and different backgrounds, because we can kind of, if we need to deep dive into a case or someone's experience, then it helps to have different people's input.
Hmm.
So, yeah.
All this to be said, that's what is considered when you're looking at prices of services.
Mm.
There's a lot more than just that one-on-one time with you. There's a lot of education and knowledge that goes on behind the scenes.
Yeah.
There's a lot of preparation. And then there's the time we spend at home charting your files as well. So, that hour and a half appointment quickly turns into 2+ hours
Yeah.
sometimes for each client. So,
Yeah. Yeah. Yeah, and I feel like, yeah, it's not just a facial. You get the expertise, you get the time, you get the support. And a lot of the times after an appointment, if you're doing something maybe a little bit more invasive and you have a lot of post care, it's hard to remember all of that stuff. And so we try and make sure it is as easy as possible for you to remember those things. We have the little cards to send you home with so you can review everything, but you still have the support of email or phone if you need us, which again is kind of factored into what you get for just the facial. You get all this additional support if you need it.
as estheticians as well, back on the training component, this industry is forever changing and evolving. And every year there's a new fad, a new trend, a
Yeah.
new study,
Hmm.
and so it is important that we're always on the up and up and doing continued education. And
Yeah.
so that's all has to be considered as well.
Yeah. Yeah.
Okay, let's get a little bit more lighthearted and fun here. Once you get your clients in the room, what are some of the things that you might, um, those moments that those moments of thought that you're having with yourself that
Yeah.
might come into play?
Oh my God, sometimes there's a lot of thoughts. I mean, sometimes you can prep as much as possible, but you're just not prepped for a certain situation, or you want a certain peel and you maybe didn't restock your cupboards or something. You got to run out and grab it. Like
Mhm.
that's happened to me a couple times, which I'd rather do that than try and like change what I'm doing. If I
Yeah.
have a plan process and I just don't have the tool with me, then I can go get it. But yeah, I mean, something I really like about what we do here is because we have these facial cards for people to fill out before they go in so they can write down their preferences for a facial. I feel like that has helped a lot with the inner chatter for me, because I'm like,
Yeah.
do people want to have a conversation? Do they not want to have a conversation? Because when I go for treatments, I usually like to be quiet and just enjoy the
Mhm.
time. So before that, I was always wondering, like, I don't want to impact their time if they don't want to chat, but if they do want to chat and they're not saying anything. So we have the option for a silent facial and we have options for different add-ons and things. So that kind of has helped, I think, the flow a bit
That's
for
so
me.
true. Yeah, it really has helped. It also helps the client because there's a lot of times where I'm wondering, are we just talking because the client feels they need to
Yeah.
talk? Or do they really want to talk? Because I'm trying to we're all
Yeah.
as professionals trying to meet our
Yeah.
clients where they're at and what
Hmm.
the energy that they're giving us, and we'll meet them there.
Yeah.
That's part of people skills. But then I get chattering in my head, like, well, are they just talking because they feel they need to?
Exactly.
So
I think
now
that
this
too.
form, they can fill it out without the presence of us standing over them, feeling
Yeah.
they can fill it out honestly,
Yeah.
and we respect them exactly
Yeah.
where they are with that form. So yeah, you're right. We also ask like, do they want certain add-ons, and do
Mhm.
they want to be filmed? Are they okay with being filmed or
Yeah.
not? So that
Mhm.
that pressure is not there in the appointment time. Because I'm one of those people pleasers who will say, yeah, sure, record me, but really deep
Didn't
down in
want
my
that.
heart, I was
Yeah.
like, no, I didn't want that.
Yeah.
You know,
Exactly.
so
Yeah.
takes
Set
the
off.
weight off of both parties
Yeah.
involved.
Yeah. Is there anything you can think of that when you're in the room that happens? Sometimes my chair is a little squeaky, and I think about that a lot. I know that people don't actually, they're not aware of it, but I'm aware of it. So, and I'm a bit of a clumsy person too. So, me doing facials, sometimes I'm like, I really have to be careful to put the bottle down quietly or like not hit the wall, and like trying to be as careful as possible, which I feel like I've gotten better at over the years. But sometimes like a cap goes flying in the middle of a treatment, or I drop something, and I'm like, sorry.
Yeah, for sure. That's so true.
Yeah.
I can be a little clumsy in the treatment room as well,
Yeah.
especially with like the little fridge. We have a little
Yeah.
fridge in
Yeah.
our room with all the
Please,
cold
nothing
rollers
fall
and
out.
things like that. And I mean, we
It's
can't really
normal.
help that,
No.
but we're not quick at reflex.
No.
I don't
Yeah.
think.
No.
Yeah, I think for me, like personally, it's like, oh, darn, I forgot my water. And am I going
Yeah.
to start coughing partway
Yeah.
through? And then the more I think about it, the
The
more
more it
I'm like
happens.
triggering
Yeah.
it in my body and
Yeah.
little things like that. Because there's nothing worse than a relaxing facial. And then your esthetician just starts,
Yeah.
like it's awful. And that's happened before.
Yeah.
Or just like moments where you see the client, they've booked in for a certain appointment. In the moment that you're reading their chart, you're like, okay, yeah, like, and you're mentally prepared to do that treatment. And then you get them in the treatment room and you have a look at them and you're like, ooh, this is not the right treatment for them.
Yeah.
How do I break the news, and how do I
Yeah.
handle this in a way that they're going to still be satisfied with their time with me today? So I have had a lot of like little mini panic moments where I'm just trying, not panic, that's the wrong word. We're not panicking. It's
No.
just like, oh, we really need to switch the plan up, and I
Yeah.
need to come up with strategy really quick here.
Yeah.
So
Yeah. You have to kind of be ready to change things on the spot if you need to for
yeah.
the client.
Yeah, exactly. Another one with us, we have an old building, like we mentioned, and the laundry is
Mhm.
right outside. Like Dr. Khadijah and I share a room, and
Yeah.
and the laundry, it can be a little bit
Yeah.
disruptive sometimes. And I'm like, oh no, she
Distracting.
just started the
I
dryer.
know.
What
Yeah.
kind of facial am I doing? Is it one
Yeah.
where I need to go shut that off?
Yeah.
Or is it one that, will this be a chatty facial? And if so, then we can probably leave it. So there's
Yeah.
like a lot of inner chatter with
Depends.
that too. Like,
Yeah.
do I or don't I turn it off?
Exactly. Exactly.
But yeah.
Something else I'll mention, not really along the same lines, but the understanding that facials and any hands-on treatment, there's an energy exchange that's always happening there. And that's something that I feel like I was aware of early on in my career, but as I do more treatments like this, I'm even more aware of it. And I think part of our job as practitioners is to be able to hold space in many different ways, but just being very cognizant of that energy exchange, because people come in with a lot of things. Some people are coming from work. There's things going on in people's lives. We do end up being kind of like almost like therapists in a way, just because we're there to listen to a lot of things that are going on if people want to talk about it. So just like for us being prepared for that and kind of making sure every time we go into a new appointment, it's a new person, it's a new energy exchange, and kind of holding that as best as we can and as kindly and with compassion. I think that's a huge part of being an esthetician. And on the naturopathic side, there's less of the physical exchange there, but there is more so on the aesthetic side.
Yeah,
Yeah.
absolutely. There's been times where I've done probably hundreds of thousands of facials at this point,
Yeah.
and I have zero reason to be nervous, but I'll get the odd time where my hands are a bit
Me
shaky and
too.
I'm like, what is going on? Like, I
Yeah.
know what I'm doing, but my energy just completely shifted. And then as you get through the facial and you start to kind of break a shell or a wall a little bit with the client, you start to learn about their day or things that are happening in your life. And that
Yep.
exchange just came right through to my
Yeah.
hands,
Yeah.
and it created this nervousness. And so, but then as soon as we have that release and that opportunity of connecting,
Yeah.
then all of that
Changes.
goes away.
Yeah.
And the shift is now, my calm shift is now coming over into her or him. So
Yeah.
yeah, I don't know. It's a pretty cool thing.
It is very cool to see.
But also requires sometimes a bit of cleansing of the room
Yeah.
afterwards as well, like,
Yeah.
or a debriefing at the end of a day. Like, it's not that there's no personality that, we can't or don't work with, but it's just, there's just a lot of shifting throughout the day that sometimes we're like, whew,
Yeah.
we need to kind of like I need to ground myself
Mhm.
again, kind of figure out where I am actually at, or my
Mhm.
equilibrium is at, letting go the rest of the day,
Yeah.
the hard energies and stories that were throughout the day. So
Yeah, I think it's important actually, probably in any job, to kind of make sure that there's a bit of a separation there, being able to be fully present and be fully present in someone's story, but then know where the
Mhm.
separation is.
Yeah.
So you're not taking a lot of that home. I mean, we take a lot of work home anyway, but to kind of leave that energy here,
Yeah.
instead of carrying it with you.
I find it especially hard during controversial political or economic times
Yeah.
where there's a lot of kind of public opinion and division, and that often comes out in our treatment room.
Yeah.
You know, no matter where you sit in those views as an esthetician or a naturopathic doctor, you know, you have to just be their soundboard and
Exactly.
go with it.
That's
But
it.
it's tough
Yeah,
to kind
it can be.
of be neutral. Another thing I will mention that is kind of, I think, typical in our industry, especially as estheticians or hairstylists, like anyone in that beauty industry, we often don't take lunches.
Yeah.
And a lot of that is because we have opportunities between like numbing time and things like that, depending on what your day looks like. But it's just kind of like the lifestyle
It
of
is.
our industry. And so sometimes we're bringing you into the room, telling you how to get in the bed and prepare. We're going to be back in a couple minutes. We like race back to the back room, eat a granola bar, chug some water, and come back again. So if we're taking just a wee bit longer than usual,
That's usually what's happening.
usually what's happening.
We eat a lot of granola bars over here.
Okay, let's talk a little bit about some treatment misconceptions. One of them for sure is that facials are just fluffy massages and or corrective.
Yeah.
That kind of seems to be the like division right now in our industry. Do you want to chat on that?
Yeah, I feel like facials are just such an underrated treatment because of the ability to do both of those things in one. Like you can bring both of those types of treatments into one experience for somebody. And I feel like for me, when I do consultations with people and I suggest facials to start, people are often surprised because facials have a certain reputation, one way or the other. Mostly that they're kind of fluffy or they're more relaxation. But I think you can pack in a lot of treatment and you can really target someone's concerns with the facial, because that is when you're really getting deep into someone's skin and really you're spending an hour with us, or you're spending about an hour and a half approximately with that person, with their skin, really getting to know it, seeing how it's responding to things, adjusting things. There's so many different components to a facial. And so we have so many opportunities to customize what we want to do in a facial that I feel like it is much more treatment than it is anything else. But because it has this relaxation component to it, it ends up being such a nice experience for people. So you get a little bit of everything. And I know for you, you've done a lot of facials as the main part of treating acne, for example. So it can get amazing results when I think it's blended very nicely.
Yeah, I think relaxation should be considered treatment.
Yeah, it is.
So I think that's a really big misconception. And I think we're seeing the industry kind of come to that a little bit more. But yeah, there definitely is like a pretty big divide, or there was at one point anyways, between you can't have both. So
Yeah.
sorry, I said that wrong. A pretty big divide between the two, like as though you can't have both.
Yeah. Yeah. I feel like for me, extractions changed my skin quite a bit. Like that is what improved my skin, because things were just so congested and nothing I was doing was really helping. But extractions just moved everything out of my skin and then I could maintain it better.
Speaking of extractions, that's probably another misconception, is there are some people who don't want to have anything to do with extractions, like client-wise, I mean. It doesn't have to be a very intense and super, super thorough process if you don't want it to be.
Yeah.
You know, again, we meet you where you are. We always ask, you know, are you okay with extractions today? Just to, you know, maybe your nervous system isn't ready for that day, and that's okay. They are really beneficial and we'd love to do them. But again, whatever you need that day is what we'll do. But it doesn't always mean aggressive. It doesn't always mean 20 minutes of them. It can just mean there's 3 screaming at me today. I'll get them done in 30 seconds and off we go.
And vice versa too, because some people come in and they just like extract everything, get in there, go hard. And there's certain things that you can't extract. I'm like, you just don't want to be poking at the skin too much. That's part of what our training is to know when we can extract and when we shouldn't be extracting, when we kind of need to leave things alone, when we need to work more on inflammation. And it depends too. I know we have a lot of people who pick their skin and it's normal, but sometimes if something's been picked quite a bit, it's really difficult. We wouldn't even want to be extracting beyond that because it can cause a lot more injury to the skin. So yeah, it can go both ways. But if you're comfortable with them, you want them, that's great. But like you kind of work with where your skin is at and what your comfort level is.
Yeah, I've definitely had that where clients come in and they're like, oh my goodness, get in there.
Yeah.
I have so much to get out. I am looking hard.
Yeah.
I can't find anything.
Yeah.
And they're like, what about here? And
Yeah.
you're just like, oh my goodness, like get rid of that magnified mirror that you have at home. Toss it. Don't look through it anymore because I don't know what you're talking about.
Yeah. And we have like a bright light and a magnifying glass there.
Yeah.
So we're looking, but sometimes it's
yeah, those ones are the ones to be left alone, I think. Or possibly what you're seeing is pores, large pores. And the cleaner they are, the more open they almost look.
Yeah, exactly.
So it probably is just clean skin that people are assuming to be blackheads.
Yeah, totally. Yeah. Especially on the nose, I think people have this idea that you can just extract it and it won't come back. And that's it. Like it's I feel like everybody says I have a problem with blackheads on my nose. It's the anatomy of the nose. The skin on the nose is different. And so it's going to fill up with oil. And it's not always blackheads. It's sebaceous filaments, which are slightly different. And so your skin will naturally keep producing them. So there's ways to keep it kind of looking smaller, like your pores on your nose, or keeping them decongested. But I feel like that's something that people want a lot, but we have to do a lot of education around that.
One of the most common comments I would say is, I have so many pores.
Yeah.
Well, yeah, you do.
Yeah,
Our whole face is full of pores. We all have them. It's just that they're a little bit more visible. And that can depend on where you are in your cycle. It can depend on your genetics. It can depend on your skincare. But ultimately, they are the size that they are. And again, like you said, we can make them appear tighter, smaller, and they will change a little bit throughout the cycle if you're a female. But everybody's got pores.
Yeah. Can't get rid of pores.
No.
You don't want to because they have an important function in the skin. But I think sometimes too, people are comparing their skin to other people's skin. And when you're looking at skin types, the pore distribution is very different between two skin types. So an oily skin type versus a dry skin type, the pores are going to look completely different. So you can't really compare something that is very genetic. It's just how the skin is. And we kind of have to work with getting it the best we can. But you can't really fight the genetics.
No.
It's what it is. It is what it is.
There's a lot of fear around lasers as well, and rightly so. Like, you should be cautious when you're going to get any form of a laser treatment done, whether that be laser hair removal or resurfacing or anything, because there is a lot of risk associated if it's not in the right hands. But unfortunately, those are the stories that we see most of. We never really brag about the success. Well, we do as clinics, but like the people who are out there blasting social media with photos, it's usually the injuries and that scream loudest to us and that stay and imprint a picture in our head. And so it is important to know that lasers, does not mean burn my face off. There's so many ways to, for example, laser resurfacing. We have a beautiful laser. It's an erbium laser, and it has so many capabilities. We can go so gentle and so light, super superficial, a light dusting of the skin, if you will, to like an extremely deep resurfacing. And again, we meet you where you are. What do you need? What kind of downtime can you afford? Are you prepared for the healing? Was there prep involved? Like, all these things are taken into consideration. So there is so much customizability when you're in the right hands with lasers. So you don't have to be scared. Just do your research.
Yeah, definitely.
Make sure you're going to the right person. And there's a lot of really great reasons to use lasers.
Well, I mean, the safety of your skin is the most important. So sometimes people will want to come in and do that deep resurfacing, but it's just not the right time. Prep hasn't been done, or it's actually just not the right treatment for your skin. In some cases it is, but if it's not, then that's when we adjust. And that's why it's so important, especially with lasers, to be doing a lot of research before you go in and choosing the right practitioner. It's because that's what you want. You want the right thing for your skin, not just, I want this treatment because I could get this result. It has to be the right match, especially skin tones. We have to be so careful with laser. It needs to be the right type of laser that you're using.
Yeah, I think an initial consultation is just so important if you're thinking about laser anywhere. You don't want to just jump into a laser treatment without meeting the practitioner without seeing the space, without learning a bit about the laser. Yeah, it's just really important to book a consultation first. It'd be a bit of a red flag to me if you booked in for laser resurfacing and we hadn't seen you yet.
Yeah.
I don't know.
Yeah, I agree. Yeah, consultation is super important in general, especially if you don't know what you want to do, but specifically for laser, just because there are so many ways we can adjust that treatment, and so we want to make sure it's the right fit before you jump into something.
Yeah, safety first. Another misconception is that we are miracle workers.
Yeah.
One
True.
facial is unfortunately not going to fix one's problems. It is a great start. It's getting your toes wet, but consistency is where the magic happens. We are working through an entire life damage or lifestyle that you've lived for however many years, and we're working against that. It's going to take a really long time and commitment to make extreme change. When you think about some of the most, I think I mentioned this in another podcast, but if we think about the most powerful and intensive, for example, acne drug, Accutane, like even that takes 3 to 4 months to really kick in and start to create change. One simple facial is not going to be that for you. It can really help to make you feel great again and an improved texture and reduce some inflammation. But if you're not back again in 4 weeks or so, it just gets right back to the old skin that you were dealing with. That also goes to say, like, facials will never outpace your lifestyle. Skincare is a lifestyle, and that's why we recommend monthly facials, because it's really part of a regime. Like your skin is forever changing. It's forever turning over. A new skin comes to the surface every 4 to 6 weeks. And if you're not continuously living the lifestyle of skincare, whether that be through your products, your nutrition, your hydration, and your treatments, like, it's all part of it.
Yeah, I agree. And going back to not being miracle workers, we see a lot of people sometimes later in life in their 50s or 60s. I've had a few clients just mention that, they never wore sunscreen when they were younger and they didn't think it was a problem until now they're noticing the pigment really coming out. And I think some people understand the process, that it takes time, and like it doesn't mean starting treatments doesn't mean all that pigment's going to just go away. But I think sometimes there's an expectation that now that I'm working on my skin that you can just like get rid of this pigment immediately, when we have to take into account that this is 50 years of development of that kind of pigment, or wrinkles or fine lines. They they have that timeline with them. And so we can't expect miracles to happen. There needs to be a consistent schedule. There needs to be a lot of work on the skincare at home to get you where you want to go. But it's also understanding that we may not be able to get you 100%. And that's normal, because that's just how the skin is. And
yeah. And that's, same with melasma, because melasma is usually triggered from a change in hormones, whether that be through pregnancy, postpartum, birth control pill, things like that. There's, sun is a trigger as well, but there's an underlying issue that is the main component of it. And so we can't outpace your birth control pill.
Exactly.
These are all things that we're going to have to work hard at together and manage for a long period of time together. Another question that I get, or I have gotten a lot of, is why do I need to microneedle here? Can I just microneedle at home with the derma roller? Though I feel like I've seen a little less of that now, but there was a bit where people were buying derma rollers, and that's a little terrifying, because there could be so much damage and you have no control of depth. We don't know where those needles have come from.
Yeah. How do you keep them clean?
Yeah. Are you reusing the same thing?
I don't know.
Like, I don't know.
I think
even
people
know
do reuse them from what
Yikes.
I know, which is like, it's very hard to sanitize those kind of needles. Yeah, depth is really, because you need different depths on different parts of your face. So how would you control that? And the angle of the needle makes a big difference too. And so the angle of a derma roller is very different than the 90-degree angle of a microneedling device. If something goes wrong, you don't have anybody to kind of help you come back from that. And then you end up having to do a lot of possibly other treatments and stuff to get back to your skin. But yeah, I feel like it's just a risk to take.
And with the derma roller too, like I can't even describe it because I haven't done it, but what they appear is like, you're just kind of almost like aerating a lawn on your face, versus a pen. The professional pens are designed and engineered to enter your skin anywhere from 150 to 2,000 times per second. So you're getting a lot of really controlled micro injuries versus a very subpar air rating of the
Yeah.
skin, not nearly as much injury, and with so much risk and possibly drag and scar tissue developing as well. So
Yeah. Yeah. I mean, the point is with treatments like this is that you want the controlled micro injury. And so I feel like derma rollers, there's not as much control with that. And so when your skin is healing, we want it to heal in a very specific pattern, which is what microneedling stimulates. Derma rolling, you don't really know what you're getting. You don't know what kind of injury you're getting, again, because of depth and because of the needle type and the speed and the angle. So you don't know what you're going to get from that versus microneedling is just a very controlled process.
do you have any quick stories or examples of any common fears that you've heard clients share in the treatment room?
Well, I guess just on the lines of microneedling. I think with microneedling specifically, it can be scary when you hear needling. And a lot of clients are concerned about possible pain associated with that. And so this is a conversation I usually have before every microneedling for the first time with a client. And something to note is that you are numbed for the procedure. And so there's not much sensation that is happening. You usually feel like the vibration of the tool in certain areas. If you're going over a little bit more of a bony area or like around the sides of the face, I feel like sometimes you can feel it a little bit, but it's not usually painful. It's just kind of like a weird sensation that you get. Sometimes people have to sneeze because when you go over like their sinuses and it just puts a little bit of pressure with that vibration. And so it makes you sneeze. But I feel like other than that, it's a very comfortable procedure. A lot of people even say they love the sound of the pen.
Yeah.
Because it's like white noise.
Yeah.
So people are pretty comfortable. It's just the initial fear. I think there's a lot of like nervousness because of the needling, but the numbing really takes care of that a lot.
Yeah. The biggest comment with first time microneedlers is like, that's it.
Yeah. I
You know?
can't even feel that.
Yeah. Which is so great.
Yeah. What about you?
I would say the same thing even with hair removal. I started doing hair removal, I think 19 years ago, and the devices then did hurt. They did, and they were not great,
Yeah.
and they were slow and monotonous, and so they've come such a long way.
Yeah.
A lot of people haven't changed their thoughts around hair removal, and it's now just kind of helping people manage the expectations around the fear of pain, and it's just so comfortable now. We've come such a long way with lasers. We have a couple different, we have an ND egg and we have a diode. Both are really comfortable, especially the diode.
Yeah.
It has extreme cooling sensations, so it's very distracting. You can't even tell there's, especially in areas where it's not a really dense hair, like there's very minimal feeling around
Yeah.
it. And I would say that's another one where they're like, oh, that's it.
Yeah.
Wow, I'm so shocked. And then they're like, well, I'm not going to get results out of this treatment. I barely felt it. And then they come back the next and like, I didn't have to shave once.
Yeah.
So yeah, that's a big one.
Yeah. I mean, there's certain areas I feel like that might be a little bit more sensitive, but it's quick. It's not a very like long-term pain that you're dealing with. And the ND YAG too, I find very comfortable because you have the cool air on all the time too. And so people feel that more than they can feel the laser at all. So yeah, I feel like both are very comfortable.
Yeah, they've come a long way. And if it is, like, I mean, we're not going to say it's completely pain-free. Once you get those first initial 3 to 4 treatments done, it starts to get really easy to get through. Like you can snooze through it or do work on your phone through it very easily.
Exactly.
So another one is chemical peels. A lot of people think that chemical peels equals peeling.
Yeah.
Because of the name chemical peel, but it really is not the case. There's a number of peels that will not create an aftermath of shedding. Majority, I don't even know. We must have like 12 to 15 different peels to choose from here at Natology, and a good 10 to 12 of them do not cause that peeling sensation. So when we say we're including a peel with a facial or as an add-on to something, it's a superficial peel that's just going to give you a nice glow and improve your texture. And the other ones we plan for, we talk to you about the management of the aftercare with Jessner peels, for example, that are going to shed on days 3 to 5, or the perfect derma peel where you're shedding 3 to 7 days. Those are entirely different and ones that we are going to discuss, plan, and do solo, not combined with other treatments. Okay, let's talk a little bit about mistakes that maybe, not even mistakes, but things that clients do that we can kind of, well, some of them are mistakes, I would say. Some of them we can just laugh at, for example, like, oh my goodness, I forgot to wash my face.
Yeah.
Like, well, we're going to wash your face for you regardless of whether you washed your face or not. I always think that's the cutest comment.
I know,
like, it's like brushing your teeth before you go to the dentist. But yeah, some big ones would be like using the retinol the night before. That doesn't mean we can't treat you. It just means we're going to have to tweak it. Yeah. Spray tanning is another big one, just because I think people think because it's not a real quote unquote tan that it's different, but we do need all artificial color to be gone before we are doing laser hair removal or even resurfacing, things like that. Yeah.
Drinking a lot of coffee before certain procedures, like if you're getting a blood draw, you're doing PRF, you're doing microneedling, injectables, because that's just going to increase the possibility of bleeding. But a lot of people don't realize that. And so sometimes we're fighting with a little more
blood.
There's
no nice way to say it. Another one would be extractions the night before. Leave those for us. We can't wait to do them for you. There's going to be less damage. But I think maybe people are doing it out of insecurity. They feel like they need to clean their skin. Here I am saying this, but I am that person that's going to brush my teeth before I go to the dentist.
Exactly.
I say that, but like, so... and floss, like I skipped for the last 4 days.
But I'll just do it right now. They won't know.
So I get it from that perspective, but please, you don't have to.
Yeah, that's what we're here for. We love extraction.
And then there's some of the magic moments that we absolutely love from all of you. One of them being checking in with us or not even checking in with us, but just sending us a message about how amazing you feel or how amazing your skin is feeling, and sending us photos and those little things. Just that follow-up is so nice to see.
It is. Sometimes we don't get to see what happens after. And so it's nice when someone messages and says their skin feels the best that it's ever felt, or their skin is glowing, or so everything's changed for them because of whatever treatments we were doing. It's just such a nice feeling.
Or you loved it so much that you shouted it out on social media.
When you share.
So helpful. We love that. Reviews are just an amazing thing to receive. I love opening up my email to you received a 5-star review.
That's the best feeling. Or even it's as simple as after a facial, when you meet your client up at the front and they are just in this like happy days because they've just had a relaxing treatment, and they say that's the best thing that they've felt, or they just feel so relaxed. Just that feeling, even if it's nothing else for their skin, just that they're going home feeling more relaxed. That feeling, I feel like it's the best.
Totally. The ones that get me as a mom are the moms. When they're in those first years of motherhood, and just it's so exhausting. There's so much sleep deprivation. There's very little time for yourself. There's very little nourishment for yourself, whether that be through food or self-care. And they've just come and spent an hour and 45 minutes with you, and they're just like in tears about it because they just needed it so badly. And as soon as they say it, I mean, hot tip, if you really want a little extra from me, just tell me that you're a new mom. I'm naturally going to give you a little bit more in that treatment room. My heart just connects with yours immediately. Also referrals.
That always feels good.
That's a big one. When you loved your experience with us enough to share it with your loved ones, that's a huge compliment. And it really helps small businesses like ours grow and succeed.
Also, our clients that become regulars, I feel like that's always so nice to see. I mean, we love seeing everybody, but when we see a certain name in our schedule, someone that's been seeing us for a while, it's just a nice feeling to have, because clients become kind of like family. We get to know like a lot of what's going on in your life. And so it just becomes it's like a special little thing when you have someone that's been seeing you for a long time.
Totally. You hug them the minute you see them and before they leave. And we've built those relationships. And that's so special. And those are usually the same clients who are like, okay, look at me. What would you do to me? I'll do anything. Like, just sign me up and book me for my next 7 appointments.
Exactly.
All trust is in us. Another little one is just, again, because we're on social media, we can kind of follow your guys' journeys online, not just within the treatment room. It is so nice to watch, especially the acne clients, their journeys, like even quietly online, just seeing their changes in their life, the confidence that they've built, the more they're showing up online. Not that showing up online equals confidence, but it, when you're going through an acne journey like that and you're just showing up in a different way, it's just like, it honestly brings so much joy to us as practitioners to see you living out your life with confidence again. So
absolutely.
we're going to do a quick fire questioning back and forth. Just to end this a little bit light, what would you say is the most underrated treatment? It doesn't have to be that we do, maybe,
just
but
in
in
general?
general in aesthetics.
I have to say facials, which
Yeah.
we kind of talked about already. I do feel like they're quite underrated because you can do so much in a facial.
Mm-hmm. Yeah, I agree. Facials, but just to change it up a little bit, I'm also going to say microneedling. I
Yeah.
think microneedling, it doesn't have that wow factor, like immediate result or
Mhm.
anything, but when you get consistent with it,
Yeah.
it's so incredible.
Yeah.
And it just changes the way your skin works entirely. So I just love it as the backbone for aging gracefully and
Mhm.
for those who have a skin dysfunction. It can really, really help.
What about the most overhyped treatment?
Oh my God, I'm going to say hydrofacial. Don't hate me.
That's a good one. Yeah.
I just think it's good.
Yeah.
But for the price that you pay for the machine and the
Yeah.
price that you as consumers have to pay for the service, I personally feel underwhelmed. And I think that there can be so much more. I don't know what to say. I think there can be so much more involved in a facial treatment when you're paying that kind of money.
Yeah. Yeah.
A much better outcome.
Yeah. For me, it would be Morpheus.
Yeah, that's a big one. And it's not because of the RF microneedling technology.
Mhm.
I just think that they went so hard on marketing that it created these really unrealistic expectations and like this go hard, go home mentality. And as a result, has created some controversy.
Yeah.
And so RF microneedling, the overall technology can be really great when used appropriately. And there's a lot of other really great devices out there that are far more comfortable
Yes.
as well. And it's not a go hard or go home mentality with
Yeah.
those devices.
Yeah.
And so I think the marketing just kind of created a bit of an unrealistic
Yeah.
expectation
I
and
agree.
this really aggressive kind of treatment plan with some practitioners. Okay, what about a smell?
Honestly, it has to be the perfect derma peel.
Yes.
That's like,
Oh,
you
yeah,
just, you
true.
know, if a perfect derma peel has been done in the clinic because it is a very distinct smell.
Yeah.
Strong smell.
It lingers for a few hours.
Yeah.
True.
Yeah.
I was just going to say burnt hair.
Yeah. True.
Yeah. Like it's not one that bothers
No.
any of us at all. We're just used to it, but
It lingers.
it just, it's one that I'll never forget.
Yeah. It's also very distinct smell. Okay. What about best part of your job?
Oh, helping people
Yeah.
feel amazing for sure. I think that's the whole reason I started this industry is just to give people the gift of confidence and relaxation.
Yeah. Same.
Yeah.
Yeah. I don't have anything else to say. Yeah, it's very much about the confidence and all the magic moments that we talked about. All of that is part of it, but just seeing someone come into themselves and be more confident and comfortable in their skin and understanding their skin, feeling empowered by that, I feel like that's the best part of it.
100%.
Yeah.
Okay, we're just going to leave it there for today. We hope you enjoyed our lighthearted conversation behind the scenes. Don't forget to share, like, subscribe, comment, all the things, or send us a message on what you'd like to hear. We're running out of ideas, so we'd love some inspiration from all of you. And that's it for today. Thanks, guys.
Next time.
Bye.